Measures adopted to prevent the spread of COVID-19 at slaughterhouses in Uruguay. A multidisciplinary Uruguayan team of members from the public and private sector developed a protocol of sanitary recommendations with specific COVID-19 measures, which have been added to the regular cleaning and disinfection practices of Uruguayan plants to protect workers in the meat industry and guarantee meat safety and quality. These measures include training operators on prevention measures and the specific contingency plan of each slaughterhouse, prohibiting staff from entering plant facilities if they have symptoms or have been in contact with a confirmed COVID-19 case, and making it mandatory to stay home under the supervision of the Ministry of Public Health, differentiating and marking entry and exit areas, and establishing staggered schedules so as to avoid crowds and crossings of people, checking staff's temperature and symptoms when entering the establishment, planning tasks to maintain the recommended safety distance of 2 meters. When distancing is not possible, physical barriers are to be placed. If neither of the 2 measures is possible, the use of proper personal protective equipment, PPE, is to be reinforced. Setting up cleaning and disinfection facilities at the entrance of production areas for washing boots, hands, and subsequent disinfection. Installing hand-washing sinks in production areas to ensure proper frequency of washing and disinfection during the working day. In common areas, limiting the capacity of places of common use, changing rooms, dining halls, restrooms, etc., and setting up shifts for their use or increasing space by attaching structures in open areas to ensure safe distancing between workers and avoid crowds. Ventilating common areas with fresh air intake. Setting up educational and informational posters with prevention measures and informing the prohibition of sharing implements of personal use. In cleaning and disinfection, recommended personal hygiene measures for COVID-19. Hand washing, protection of nose and mouth when sneezing, mandatory use of face mask, avoid touching eyes, nose or mouth, avoid physical contact such as kisses or hugs. Cleaning and disinfection of workplaces in relation to regular practice, increasing frequency in common areas, as well as surfaces of usual contact, knobs, handles, buttons. Proper personal protective equipment for the cleaning staff, taking biological risk into consideration. Availability of suitable chemical products to ensure correct disinfection of the SARS-CoV-2 virus on surfaces and equipment. Bagging and transfer of work uniforms to washing facilities, to be cleaned at temperatures between 60 and 90 degrees Celsius. Many plants in Uruguay are carrying out random tests on staff and are reinforcing disinfection of product packaging. Plants have also introduced the concept of sanitary break, which consists of the total stoppage of activities in the face of positive cases of COVID-19 for the application of cleaning and disinfection procedures. The activity is resumed once it is verified that the workers have a medical discharge or a negative PCR test by nasopharyngeal swab. General context of Uruguay. Coronavirus UY is a free app monitored by the National Health System that allows all citizens to track their health status. With a population of 3.4 million inhabitants, the country is effectively complying with its vaccination plan and has set a target population of 2,800,000 people. Vaccination is currently underway and is showing clear signs of efficiency through a sound structure. To access official information of the system, go to monitor.uruguaysevacuna.gub.uy.